Hi, everyone. Welcome to another Lunch and Learn webinar sponsored by Adiva Nutritionals. This is I think a really fascinating subject today. We're going to look at anti-cancer nutrients that have been used in human clinical studies that have shown some impressive results. There's really only a handful of nutrients that have been used, and there's a lot of experimental evidence. And experimental evidence is important. But when you can actually show that things in cancer patients are being meaningful, whether as an adjunct to cancer care, to help treat the disease, prevent remission, decrease side effects, decrease further progression of the disease. This becomes really meaningful stuff that really helps to substantiate the value of targeted nutritional supplementation. So this is what I promised I would deliver today, and I don't think you'll be disappointed. So the nutrients that we're going to see in this presentation are these 15, right? And you're familiar with most of these, so we're not going to just rhyme them all off. So let's start with vitamin D. So vitamin D in cancer, particularly studies have been done with prostate and breast cancer patients. In terms of prostate cancer, and I'm just really going to have to hit highlights here because I have way too many slides for us to drill down deep, and I'll send you a copy of these slides after the presentation. So I'm just going to touch on the key aspects that you see on these slides. So this study in 2005 in the Journal of Nutrition and Cancer, taking 15 prostate cancer patients, giving them just 2,000 IUs of vitamin D a day for 2 to 3 months. That's not even a high dose. But in 9 of the 15 patients, the PSA level decreased or remained unchanged. Normally in prostate cancer, the PSA continues to rise because it's cancer and cells the cancer is progressing. So here is the PSA is going down because the cancer cells are being forced to act more like normal cells and have a less malignant style profile. And also probably triggering the immune system to come and knock out some of the cancer cells. So there's a significant decrease in the rate of the PSA rise after administration of vitamin D compared to before vitamin D administration. So the median PSA doubling time increased from 14.3 months prior to vitamin D to 25 months. So the time it takes for the PSA level to double has been tremendously slowed down. This happened in 14 of the 15 patients. This is very important because the PSA doubling time is an important marker for whether or not this cancer is likely to metastasize. So you see at 5 years, 65 to 75% when PSA doubling time was less than 10 months, right? So the distal metastasis in prostate cancer is more likely to occur if the PSA doubling time is less than 10 months compared to if the PSA doubling time is greater than 10 months. So because vitamin D has been shown to slow the rise in the PSA substantially, this for people who are undergoing watchful waiting of prostate cancer, this is a very meaningful outcome to have. It means the cancer is going to be less likely to spread throughout the body. So, the researchers conclude that this is a very useful adjunct to be using in certain types of prostate cancer cases. What about in vitamin D in breast cancer? Well, we have great evidence to show that vitamin D, the higher the blood vitamin D level in women who have had breast cancer, it doubles their survival time. So the first important study on this was in 2007. It was a 4-year clinical trial involving, over 1,100 healthy postmenopausal women, giving them vitamin D and calcium to see if it could, decrease risk of osteoporosis. But they said not only that, but a 77% reduction in incidence of all kinds of invasive cancers, including breast cancer, in the group that got the vitamin D at just 1,100 IUs a day. So on March 14th, in the Journal of Anti-Cancer Research now showed that breast cancer survivors would be well advised to have their vitamin D level in a higher range. So the researchers analyzed five large breast cancer studies involving a total of almost 4,500 breast cancer patients. Average follow-up time was 9 years. The data showed that women after breast cancer treatment who maintain a blood vitamin D level above 30 nanograms per milliliter, that's 75 nanomoles per liter here in Canada, had double the survival rates than women whose blood level was down at 17 nanograms, or around 42 nanomoles per liter. The researchers say, in the United States, the average vitamin D level in breast cancer patients is usually around 17. So they're not getting this survival benefit. So in Canada, that 30 nanograms per milliliter target is 75 nanomoles per liter, whereas 17 nanograms per milliliter is 42 nanomoles per liter. You want to be at 75 or 80 at least. Then B. Sharif, who's one of the cancer researchers looking at this, he's saying breast cancer patients would be well advised to increase their blood level of vitamin D to 80 nanograms per milliliter, which would be 200 nanomoles per liter based on all the evidence. That's a pretty high level of vitamin D. How does vitamin D help to prevent breast cancer? It slows down the rate of cell division. It encourages breast cells to fully differentiate so they're more mature, modulates immune system function, and it increases the secretion of E-cadherin. So E-cadherin is a molecule that attaches one breast cell and one cell to another. And when the cells are connected, then the communication is intact. Cancer cells tend to not express E-cadherin, so they can become rogue cells and start multiplying and dividing without their neighbor healthy cells knowing about it. So when you force the expression of E-cadherin, it increases communication between cells. The cells in the neighborhood see that the cancer cells are up to no good, and they can help to bring in immune cells and secrete certain chemicals themselves that would help to control the cancer so it doesn't become as invasive. So vitamin D enters the cells of the body, attaches to vitamin D receptors, then it gets co-transported to the nucleus with the retinoid receptor, where it specifically speaks to certain genes. It's like a hormone, really, encouraging the cells to produce certain types of gene products that cause the cell to mature, slows down the rate of cell division, and in immune cells improves the immune cell's efficiency to find cancer cells and knock them out. So many cancer cells maintain vitamin D receptors. When you stimulate those receptors, they synthesize more E-cadherin, which in turn puts on the brakes of the ability of the cancer cell to invade adjacent tissue. And so B. Sharif feels that that's one of the main ways that vitamin D helps to prevent breast cancer and prevent breast cancer progression and recurrence. Now, Cedric Garland, who's one of the early vitamin D researchers on cancer, in a 2011 meta-analysis, he said, I think that most women should maintain a vitamin D blood level at 125 nanomoles per liter. That's associated with a 50% lower risk of breast cancer across the population. So I think that might be the target for most women to shoot for. Cedric Garland is a guy who's been looking at vitamin D research for many years. Keep in mind that once you get to 250 nanomoles per liter, you're getting into vitamin D toxicity. So, sometimes less is more. These are all the vitamin D references that I'm citing here that you can look at in your own time. What about calcium in cancer? Well, with respect to colon cancer, we have some amazing evidence. Over the past 25 to 30 years, studies have suggested that calcium may confer protection against colorectal cancer. Animal studies really show that. A meta-analysis published in 2014 in the International Journal of Cancer has provided additional evidence. So in this Boston-based the study, scientists conducted a dose response meta-analysis of 15 studies involving 12,000 cases of colorectal cancer, looking at calcium intakes from 250 to 1900 milligrams. The study duration was 3 years to 16 years. Here's what they saw. That for every 300 milligram increase in calcium from supplements, there was an associated 9% reduction in risk of colorectal cancer. And that for every 300 milligrams of total calcium from supplements and food, there's an 8% decrease. So whether the individual relied on food or supplements, every 300 milligrams of calcium consumed, there's a corresponding colorectal cancer risk reduction by 8 to 9%. So that means that if you're getting the amount of calcium you need to prevent osteoporosis, about 1,200 milligrams a day, that translates into a 32 to 36% reduction in colorectal cancer. So understand that most people across the population, especially as they get older, that their calcium intake from food is only about 650 milligrams. Most people benefit from at least 500 milligrams of calcium supplementation a day. So that takes us to this study in 2004, where they took patients that had, this is the calcium polyp prevention study, the randomized double-blind placebo-controlled chemo prevention trial among patients with recent colorectal adenomas. So adenomas are polyps that are benign, but it's those adenomas that can easily undergo malignant transformation over time into adenocarcinoma, which is the primary form of colorectal cancer. So 950 patients were randomly assigned calcium carbonate at 1,200 milligrams a day or placebo. The follow-up colonoscopies in these high-risk people that already had colorectal adenomas were conducted approximately 1 to 4 years after the qualifying examination. The group receiving the calcium supplementation showed pronounced anti-cancer effects on advanced colorectal lesions compared to the placebo group. Other studies, including randomized clinical trials, have also shown that supplementation with calcium is associated with decreased risk of colorectal adenoma recurrence and colorectal cancer. So the 2003 to 2005 National Health and Nutrition Examination showed that the median, which I just showed you that, I'm sorry. So how does calcium reduce the risk of colon cancer? It binds to secondary bile acids. So as you secrete bile with your meals to emulsify fat, some of the bile goes through the intestinal tract, can get converted into secondary bile acids and stimulate colon cancer development. Calcium binds to bile acids, reducing their conversion to secondary bile acids, so they can't actually generate colon cancer. Calcium also has a direct effect on slowing down the rate at which intestinal epithelial cells divide. When you slow down the rate of cell division, you reduce cancer risk. There's fewer genetic mutations. So it slows down the colonic epithelial proliferation rate. At the same level that calcium is reducing osteoporosis, say 1,000 to 1,500 milligrams a day, that's associated with a reduced risk of colon cancer. So what you want, I'll note also that blood levels of vitamin D at or above 75 nanomoles per liter are also highly correlated with decreased risk of colon cancer. So calcium and vitamin D work together to help reduce colon cancer risk. So here are the references on that I think you'd find of interest. So in those high-risk people that have already had adenomas, after those adenomas are removed, these people are high risk for recurrence of adenomas. The ones that get the calcium supplementation of 1,200 milligrams a day, a dramatic reduction in recurrence. That's a huge intervention to see. Folic acid and cancer, well, with respect to colon cancer specifically. So in the World Journal of Gastroenterology in 2008, we saw that individuals who had recurrence of colorectal adenomas, these polyps recurring, they gave 94 of them, they selected for this study, they gave them 5,000 micrograms of folic acid. That's a pretty high dose, actually. So among the 94 subjects who completed the study, there was a threefold increase in polyp recurrence in the placebo group. So the group that got the folic acid didn't have the recurrence of the adenomas. That's amazingly it's a significant finding. In the 2008 study was suggested that increased responsiveness of these subjects was, may have been due to greater tissue accumulation of folic acid. The point here is that most people don't have over their lifetime enough accumulation of folic acid to prevent these adenomas from forming. That becomes the take-home message. This is based on previous studies showing that mucosal folic acid levels may be a determining factor in the development of adenomas, as researchers have demonstrated the levels of folate in adenoma, carcinoma, as well as normal appearing adjacent mucosa are lower than in corresponding polyp-free controls. People who don't have formed polyps tend to have higher tissue levels of folic acid because they accumulated it over their lifetime. And you'll see how folic acid prevents it. So we think that folic acid is sort of multifaceted in its ability to prevent colon cancer. So first of all, folic acid marginal deficiency may result in misincorporation of uracil into DNA instead of thymidine, forming these types of mutations, these spontaneous mutations that lead to chromosomal abnormalities and DNA synthesis. So you create a DNA base mutation error because you don't have enough folic acid to make thymidine. And so you're at risk for having these base pair mutations that go on to lead to cancer. Folic acid supplementation at supraphysiological levels, 5 milligrams a day, has been shown to restore DNA methylation status in patients with colorectal neoplasms. So people that actually have colorectal cancer, you can restore DNA methylation with high dose folic acid. But the idea is don't get to a point where you need high dose folic acid. Get the right amount each day. We see that supplemental folic acid and its metabolite 5-methylfolate also inhibits epidermal growth factor receptor promoter activity in colorectal cancer cells. by enhancing methylation. I'll show you what that means. So a lot of times in colon cancer, breast cancer, and prostate cancer, the epidermal growth factor receptor is overexpressed. So here's the epidermal growth factor receptor here. When it's overexpressed, it tends to send messages down to the nucleus to cause the cell to divide, either here or through receptor tyrosine kinase, down through nuclear kappa factor kappa beta, overstimulating the nucleus to cause cell division to be upregulated. So that's really important because in certain genetic-based colorectal cancer, the cells overexpress these epidermal growth factors, and you get this constant stream of impulses that increases the risk of adenomas, polyps, and then colorectal cancer as a result of that. So there's clinical support for the hypothesis comes from patients who have undergone colon polyp removal, whereby folic acid supplementation at 5 milligrams for 1 year led to decreased activation of several transcription factors that are commonly overexpressed in cancer cells. Some people just genetically have a greater expression of some of these growth factors and receptors. More specifically, folic acid supplementation has been shown to decrease the activation of the beta-catechin Wnt pathway, which I'm going to show you next. Let me show this to you. Here's the Wnt path. Here's a receptor on, say, a colon cell where the Wnt pathway is turned off, so you don't have this translation. Here's where it's turned off. You don't have the final beta-catechin stimulation of the gene. When the Wnt beta-catechin pathway is turned on, then you have this stimulation down through all these transcription factors that eventually turn on the gene to secrete gene products that cause the cell to divide quickly. So what we're seeing is that folic acid can shut down the epidermal growth factor receptor and also the Wnt beta-catechin receptor and signal transduction pathway. So we're understanding the mechanism through which this happens. Also, folic acid helps to prevent the loss of what's called the DCC gene. This is deleted in the colorectal cancer. The DCC gene is like a tumor suppressor gene that prevents the cell from being able to be converted into a cancer cell. So folic acid helps to prevent the loss of that very important tumor suppressor gene, which is like a surveillance gene within the cell. All of these things tend to make folic acid an invaluable aspect of preventing colorectal cancer, preventing recurrence of cancer of the colon, we think, and also definitely decreasing the risk of recurrence of polyps. So a low serum folic acid has been shown to increase risk of chromosomal breaks in cancer. And these are subgroups who are at very high risk, but also people who are taking certain drugs, people who drink even moderate amounts of alcohol, they smoke cigarettes, they're depleting their folic acid. Remember that colorectal cancer is the second leading cause of cancer death in our society. We know that a lot of it could be prevented through better dietary and lifestyle behaviors. Calcium, vitamin D, and folic acid optimal status is part of prevention. The evidence all points in that direction. What about anti-cancer or antioxidants in cancer? With respect to breast cancer and prostate cancer, we have some impressive data. I've shown this to you in other webinars. 2 recent studies have shown that breast cancer survivors taking multiple vitamins with antioxidants show lower recurrence rates. So in this study, it's a 2-year follow-up period after breast cancer treatment. The women who were in the top 25% following a healthy lifestyle who regularly took multiple vitamins had a 60 to 70% reduction in risk of dying from any cause during the study. That's a remarkable outcome for breast cancer survivors. Then in the Shanghai, China study, we saw the same thing. Almost 5,000 breast cancer survivors given antioxidant supplements, vitamin C, vitamin E, selenium, and or with multiple vitamins over the 6 months after diagnosis and treatment. You see a decreased risk of cancer recurrence by 22% and overall mortality by 18% of the group getting the supplements. The first study of this kind was back in 1994 in the molecular aspects of medicine, where Folkers and Lockwood took 32 high-risk breast cancer patients who were treated, but they already had spread to the axillary lymph nodes. They gave them a supplement protocol of vitamin C, vitamin E, beta-carotene, selenium, vitamins and minerals across the board, essential fatty acids, and coenzyme Q10. And what they saw is that the main observation was the group of individuals, like those 32 women in the high-risk category for recurrence, none of the patients died during the study period. None of them showed any signs of further metastasis. The quality of life was outstanding. They needed less pain medication, and 6 patients showed partial remission. That means that they had a regression of the lymph node involvement. That was outstandingly amazing to see, because that, it's hard to make that happen in high risk women. So that was the first time we saw any supplements used in a breast cancer survivor situation. Here is the study in 2005 by Dr. Dean Ornish in the Journal of Urology, where he used his sort of vegetarian, low-fat diet that he uses to prevent heart disease. He gave it to patients that had low to moderate grade Gleason scores because they had prostate cancer, but it was sort of low to moderate. So watchful waiting was going on. So a select group of these people got his low-fat diet with fruits and vegetables, legumes, soy products, but he also supplemented them with vitamin C and vitamin E and selenium. He studied 93 men. Half chose to go on his program. The other half became the control group. So the men that followed his diet and supplement program, after 12 months, the PSA, the treated group of men, decreased. These are men with prostate cancer. The PSA is going down by 4% after a year. The group just staying on the typical North American diet, no supplements, their PSA is rising by comparison, which increases the likelihood it's going to spread through their body. So these intervention studies are quite eye-opening. Then there's vitamin E succinate, which you're going to see is the only form of vitamin E that is effective as an anti-cancer molecule. No other forms of vitamin E do what I'm about to show you. So over the years, we've seen a lot of studies with vitamin E succinate experimentally, inhibiting the epidermal growth factor receptors here on the surface. This is very common in breast, prostate, and colon cancer. Also inhibiting the BCL2. So when a cell's becoming cancerous, the Bax protein, the p53 tumor suppressor gene, encourages the gene production of the Bax protein. It goes to the mitochondria, causes the cell to die before it can become a cancer cell and be a threat to the body. But some cancer cells, what they do is they secrete BCL2 and they block the ability of the cancer cell to commit suicide. Vitamin E has been able to block the effects of BCL2, so a cancer cell can induce apoptosis and undergo programmed cell death. No drugs can do that yet. And also, cancer cells tend to desensitize their cytokine receptors. So if an immune cell tries to get the cancer cell to commit suicide through the caspase enzyme system, these receptors are desensitized. Vitamin E resensitizes these receptors. So there's all kinds of experimental evidence with human cancer cells that vitamin E succinate can help to prevent cancer and be an effective sort of adjunct to cancer. Remember that many breast, prostate, and colon cancer patients have an overexpression of the epidermal growth factor receptor. Vitamin E can help to tone that down. It can also inhibit the release of vascular endothelial-derived growth factor. Cancer cells secrete that to form new blood vessels so that they can get more nutrients, so more cells can keep dividing and they can metastasize. Vitamin E succinate has been shown to inhibit that process as well. So that's all the original evidence we had on vitamin E succinate. But in recent years, we're seeing there's an additional way that vitamin E succinate helps to control cancer, and that is by causing a massive amount of free radicals to be produced in cancer cells, but not in host cells, which causes the cancer cells to die. So vitamin E does that by inhibiting the cytochrome pathway, where CoQ10 is helping hydrogens go down the electron transfer chain. It binds to complex 2, so it interrupts the cycle. Hydrogen electrons leak out into the cytosol and combine with oxygen to form all kinds of free radicals. Cancer cells don't have a lot of antioxidant defense, so the cancer cells with all the free radicals overwhelms them and they undergo programmed cell death or apoptosis. So that's this cancer killing effect that's really amazing. And we see in human breast cancer cells that have the HER2 receptor, the epidermal growth factor receptor that's overexpressed, you tend to get these cells being killed off, it's very hard to get these cells to commit suicide. So based on all that evidence in 2005, they took a patient who had malignant mesothelioma and they gave them vitamin E succinate. And because malignant mesothelioma is a lung cancer caused by exposure to asbestos, as you know, there's really no medical treatment for it. They said, let's just try this and see what happens, because evidence has shown experimentally that vitamin E kills human malignant mesothelioma cells in vitro. So they said, let's try it. So they did it with this patient. And the data revealed a significant clinical benefit of vitamin E succinate therapy, causing a reduction in the tumor volume. So the tumor on CAT scan is shrinking in the person's lung. It improved their well-being. It had a lethal type neoplastic, in patients that had a neoplastic pathology that's very severe. So the only treatment option really for a patient with malignant mesothelioma right now is actually vitamin E succinate. There isn't anything else. So these are really difficult cases. So more clinical studies are being planned, but vitamin E succinate is the only form of vitamin E that has anti-cancer properties. In recent years, 2021, we also saw in human cervical cancer cells, it decreases the expression of the CD47 receptor on cancer cells. That's really important because that receptor inhibits the phagocytes from being able to kill the cancer cell off. So when you inhibit the expression of the CD47 receptor on a cancer cell, the macrophage immune cells can come and kill the cancer cell, wipe it out, and generate an immune response. So this is some further experimental evidence that shows tremendous promise. Only vitamin E succinate's been able to demonstrate that. So this is one of the reasons why, it's not the only reason why, but if you look at the Adiva multiple vitamin, I had some of this research in mind when I was formulating it, to make sure that each day you get 1,000 milligrams of vitamin C, 400 I use of vitamin E succinate. You won't find another high potency multiple vitamin that has vitamin E succinate. You'll see other forms of vitamin E, but you won't see this. I don't know why. Selenium, 200 micrograms. There's the vitamin D. There's folic acid at 400 micrograms, beta carotene, calcium at 500 milligrams with magnesium. So for a lot of patients, this solves a lot of problems of getting adequate tissue stores in the body that can be very meaningful in preventing the biological steps that are associated with cancer, as I've shown you. Again, that's a closer look at the vitamin breakdown. It's really, 7 or 8 supplements all in one bottle when you think about it, but it's very cost effective. What about epigallocatechin gallate, the sort of green tea polyphenols? Studies looking at prostate, breast cancer, chronic lymphocytic leukemia, very impressive stuff. Experimental studies have shown that green tea catechins like EGCG can cause cancer cells to commit programmed cell death, and human cancer cells inhibiting and causing all kinds of human cancer cells to commit suicide. Experimental studies show that it turns on genes like the BAX gene, which is required to make the peptide that will cause cancer cells to commit suicide, and also inhibits the BCL2, which I just showed you, can block apoptosis in a cancer cell. So by switching these things on and off, you actually encourage cells to commit suicide. So once again, here's the BAX peptide. If a cell is becoming cancerous, the P53 tumor suppressor gene will encourage the secretion of the BAX peptide. It'll go to the mitochondria, cause the cell to die. But if the cell secretes BCL2, it puts up a roadblock right there, so the cancer cell has a chance to thrive. So ECGC in experimental studies turns on the BAX protein, turns off the BCL2, kind of like vitamin E succinate. So experimental studies show that it's very effective with all kinds of different human cancer cell lines. And it also decreases the secretion of vascular endothelia-derived growth factor, which I showed you causes cells to form new blood vessels, inhibiting angiogenesis. It's blocking that VEGF for tumor access to more blood. This is incredible, blocking the secretion of VEGF. So ECGC from green tea is an incredible anti-cancer nutrient. So they said, let's put it to the test. I said, one more thing. It also inhibits receptor tyrosine kinase in cancer cells. So once again, when receptor tyrosine kinase is overexpressed, it sends messages down to cause the cell to divide this way, and also down through nuclear factor kappa beta, which gets released and goes to the cell. So in cancer cells, when you look at the genomic printout of a cancer cell, very often they overexpress receptor tyrosine kinase. It's a driving factor that keeps cancer cells dividing and progressing. So EGCG is one of the few molecules that's been shown to inhibit receptor tyrosine kinase in cancer cells. And you see further evidence of it. Here's the receptor tyrosine kinase going down and stimulating cell growth, proliferation, and survival in cells that should be committing suicide. So it's very specific just to cancer cells that leaves the host cells alone. So they said, well, let's test this, because we know that in Asian men who drink a lot of green tea, prostate cancer is much lower. So they said, let's take men that have pre-malignant cells in their prostate gland, which is known as high-grade prostate intraepithelial neoplasia. These are men where these pre-cancer cells are very likely going to convert into prostate cancer cells in a timely fashion. So they said, let's take these men, let's give them 3 capsules a day of 200 milligrams of these green tea catechins. So they had 600 milligrams a day, and after 1 year, let's see what happens. Well, they said after 1 year, of the 30 men given the green tea catechins, only 1 man had a tumor that progressed to full-on prostate cancer, whereas among the 30 placebo-treated men, 9 of them ended up having prostate cancer within 1 year. So only 1 man in 30 gets prostate cancer in the green tea group, and you have 9 men in 30 develop prostate cancer in the placebo group. That's a significant difference. That's a 3% progression versus 30% progression. Also, the men that got the green tea catechins, lower levels of PSA, and it improved signs of prostate enlargement. They could urinate more. The prostate gland's shrinking and the tumors are shrinking. That's an incredible outcome. So they said, well, let's follow this up. So they took men in 2009 who had localized prostate cancer, and they gave them green tea catechins as well for 35 days, roughly, before they had a radical prostatectomy. And then they looked to see before the radical prostatectomy, has anything changed? They said, oh, their PSA is lower. They're secreting less growth factors for the tumor, less vascular endothelial-derived growth factor versus the placebo group. The insulin receptors were down-regulated, which is very important because insulin receptors tend to drive cancer cells to divide faster. And their liver function tests were normal, didn't cause any adverse effects. So here's the hepatocyte growth factor. Prostate cancer cells and breast cancer cells often overexpress what's called the c-Met receptor. And when it's stimulated by the hepatocyte growth factor, it causes the cells to survive and to proliferate, and cancer cells are dividing faster. So what we see in this study with men is that it inhibited the release of hepatocyte growth factor from fibroblasts in the neighborhood. So you toned down the effect on the c-Met receptor. These are all important factors that are related to decrease progression of prostate cancer. So in these men with serious localized prostate cancer awaiting a radical prostatectomy, in the group given the epigallocatechin gallate supplements, you see a favorable response in terms of decreasing the aggressiveness of the tumors. Same thing in women who are awaiting breast cancer surgery. So we've seen that giving women breast cancer ECGC is also helpful. So here's the study in 2012. The American Association of Cancer Research published a study in 2012 looking at the anti-cancer benefits of women diagnosed with breast cancer who are awaiting surgery. So they gave them these high doses of EGCG versus placebo. The results showed that the green tea catechin group had a significant impact on cell signaling mechanisms that encourage cancer cell suicide. The catechins also toned down pathways linked to metastasis and reduced secretion of growth factors like hepatocyte growth factor that enables tumors to feed themselves new blood vessels, also vascular endothelial-derived growth factor. It's unbelievable. So again, toning down hepatocyte growth factor and inhibiting the release of vascular endothelial-derived growth factor. Then in 2013, a phase 2 clinical study involving 42 patients with chronic lymphocytic leukemia gave them 2,000 milligrams of EGCG twice daily. That's a fairly high dose for 6 months. The results showed that 31% of the patients demonstrated sustained reduction in the absolute leukocyte count. So these are individuals with leukemia. And of course, their white blood cell count is extremely high, and you're actually bringing the leukocyte count down by greater than 20% in the treatment group in 31% of cases. That's amazing. Their lymph nodes were also shrinking, also a great sign for patients with leukemia. So they said overall 29 patients or 69% fulfilled the criteria for a biological response with either sustained decline in the absolute leukocyte count or a reduction in the lymph node size during the 6 months of active treatment. That's a tremendous adjunct to treatment for people with this type of acute leukemia. So in our product Body Burn, which I really formulated for weight loss, improve glucose regulation, improves thermogenesis, shut off appetite. This dose of catechins and the polyphenols here in the decaffeinated green tea extract is very significant. I take, even though I'm at my ideal body weight, I work out. I don't know if I really need Body Burn to, keep my waistline where it is. But I take 2 or 3 capsules a day because of the anti-cancer properties of the green tea extract. Curcumin in cancer. Well, it's been shown to be very helpful in this very high risk group that have familial adenomatous polyposis. So as you know, there's all kinds of experimental evidence for curcumin in cancer. So I laid it all out for you here. You can read that on your own time. But here's a study in 2006 with patients with familial adenomatous polyposis, or FAP. It's an autosomal dominant disorder where the person forms hundreds of colon polyps that usually do a colostomy on these people because they know that some of these polyps are going to undergo malignant degeneration and becomes cancerous. So they said, well, if curcumin can really tone down cancer risk, let's try it, because all we really have to, after they remove the colon, they can't remove all of it. So the remaining part of the colon continues to form all kinds of polyps. So they have to remove them every 6 months. So they give these people aspirin and other types of non-steroidal anti-inflammatory drugs that block the cyclooxygenase enzyme, because cancer cells and these types of cells make a lot of prostaglandin series 2, which increases their cell division rate. So they took 5 FAP patients. They gave them curcumin at 400 milligrams 3 times a day, as well as quercetin at 20 milligrams 3 times a day. All 5 of these patients had decreased polyp number and size from baseline after 6 months of treatment. The mean percentage decrease in the number and size of polyps was 60% decrease in the number of polyps and a 51% decrease in the size of the polyps. That's an amazing outcome to see. So the combination of curcumin and quercetin appear to have a tremendous benefit on these people who are super high risk for the development of cancer. In 2019, there was an update published in other human trials where they've been using curcumin in human cancer patients as an adjunct to advanced pancreatic cancer and chronic myeloid leukemia and in squamous cell carcinoma, all showing really impressive results. What about Boswellia in cancer? Well, you're going to see how it affects brain and cancer of the bladder, actually. So this is in the Integrative Cancer Therapy Journal 2017, a case with bladder cancer they're going to talk to you about. But there's all kinds of studies experimentally showing that Boswellia and the boswellic acids have all these tremendous anti-cancer properties that have been shown. And then you have some evidence from humans where you reduce the peritumoral edema in glioblastoma patients and reverse multiple brain metastasis in brain cancer patients. It's one of the very few agents that can cross the blood-brain barrier and have anti-cancer effects. It's an amazing little product, Boswellia. So in this journal report in 2007, they talk about a patient who had bladder cancer, 52-year-old Hispanic male. He has bladder cancer and he refuses to have medical treatment, which he should have had. So the patient basically will have the tumors removed, but he doesn't want any follow-up therapy. So what happens to this guy is over time, a couple of more tumors form, they remove them, but then he decides to take Boswellia as his only treatment to prevent recurrence of the tumors. Within the first year after the diagnosis, the patient experienced 2 recurrences. Recurrent tumors were removed using the standard therapy. After the second recurrence, the patient has no detectable cancer in the bladder based on cystoscopy for 14 months and has had an intact genital urinary system. So the Boswellia seems to be preventing the recurrence of bladder cancer in this really super high risk person who should have had follow-up chemo and or radiation, and or for bladder cancer, they also do injections of the BCG vaccine, which is the tuberculosis vaccine, to bring more immune cells to the site. He refused to have all that. He just used Boswellia supplementation. Boswellia supplementation may also be important for brain cancer patients undergoing radiation therapy by reducing cerebral edema. So you see patients that are undergoing radiation therapy for brain tumors, if they can give them steroidal drugs like prednisone, but it has all kinds of side effects. What they're seeing is that we see a reduction of cerebral edema of 75% was found in 60% of patients who received the Boswellia, and a reduction in cerebral edema of over 75% was found in 60% of patients who received Boswellia, and in 26 of patients who received the placebo. So a dramatic improvement in the Boswellia cases versus the placebo. But Boswellia's improvement benefit on cancer patients is significant because Boswellia supplements come with a lot less side effects than steroid drugs, as they're saying. So decreasing cerebral edema in brain cancer patients undergoing radiation. Also, Boswellia creams in patients who are undergoing radiotherapy for breast cancer. Putting Boswellia cream on the site where the radiotherapy is being done reduces the erythema and pain and swelling. We've seen that in a number of studies. So in our product called Nature's Relief, which we really recommend for joint inflammation and autoimmune conditions and myositis and tendonitis, bursitis, but the curcumin and the Boswellia in there, they have important anti-cancer properties, as a lot of the evidence has pointed to. So I don't really have an inflammatory condition, but I take 2 capsules of Nature's Relief a day to get these agents into my body to help block many of the steps that are related to cancer development. I think it might be helping. And also white willow bark extract and ginger also blocks cyclooxygenase and lipoxygenase like curcumin does. I think these are important properties as part of a chemo prevention plan in terms of lifestyle. So this is why sometimes it might be advisable or a consideration to take Nature's Relief, even if you don't have an inflammatory condition. Indole-3-carbinol in cancer. Well, with recurrent respiratory papilloma. So this is the experimental evidence on indole-3-carbinol from cruciferous vegetables. It just goes on and on and on. It's unbelievable, the evidence experimentally for indole-3-carbinol preventing cancer and shutting down steps within cancer cells to make them less malignant, get to commit suicide, all kinds of great stuff. So they said, well, let's test it. So in 1998, they did the first assessment. They took 18 patients with recurrent respiratory papilloma. So these are like polyps that form in the respiratory tract that they know can undergo malignant degeneration. So they gave them indole-3-carbinol supplements. 33% of the study patients had a cessation of their papilloma growth and have not required surgery since the start of the study. 6 patients had reduced papilloma growth rates, and 6 patients showed no clinical response. So like many other things, a certain percentage of people respond and some don't, but there's a high percentage of responders in this study. There's all kinds of ways that indole-3-carbinol is helpful. It also helps to promote the safer types of estrogens in your body. What they said is the preliminary results of treating recurrent respiratory papillomatosis with indole-3-carbinol holds promise. We conclude that indole-3-carbinol appears to be a safe and well tolerated and may be an efficacious treatment for recurrent respiratory papilloma. So in 2003, they did another study with a larger group. All patients underwent complete surgical removal, then started on the indole-3-carbinol. 33% of the patients experienced remission of the papilloma growth and did not require surgery while on indole-3-carbinol. 30% of the patients had reduction in their papilloma growth that resulted in less frequent surgery, and 36% had no clinical response. They said that the indole-3-carbinol has been found to be a successful treatment for recurrent respiratory papillomas because it blocks so many steps in the cancer pathway. Then there's medicinal mushrooms, which I've talked to you about many times before. I like to give patients even undergoing cancer treatment medicinal mushrooms, because it doesn't affect or block in any way chemotherapy drugs as some other supplements might. But as one researcher stated, medicinal mushrooms have been shown to have the ability to stimulate the immune system, modulate humoral and cellular immunity, potentiate anti-mutagenic and anti-tumorigenic activity, as well as rejuvenating the immune system weakened by radiotherapy and chemotherapy in cancer patients. So cancer patients, to bring their immune system back after treatment, these medicinal mushrooms are highly advantageous. So medicinal mushrooms have beta glucans. They get into the receptor on macrophages in the gut when you swallow them, and then the macrophages will spit out little fragments of the beta glucans and stimulate other immune cells, which will activate them to have a much greater effect on killing pathogens and cancer cells. So there's no other nutrient that can do that so specifically. So I would encourage you to read these 3 research papers that should really lay out all the evidence, especially this one, Application of Integrative Oncology, Integrative Medicine, February 4th, 2014. Immune modulation from 5 major mushrooms. It's an incredible research review. So, this is immunodetox prime. As your immune system gets weaker, as you get older, I think by age 50, you should be taking a product like this to support your immune system so you don't have such virulent infections and or cancer. But two of the main ingredients in here are reishi mushroom extract and the indole 3-carbinol. So I'm over the age of 50. I take 2 of these caplets every day. Lycopene and cancer, well, particularly prostate cancer. So experimental evidence shows a lot of evidence around lycopene and the prevention of many types of cancer, but especially prostate cancer and some breast cancer studies as well. So there's 6 human clinical studies where they gave men with prostate cancer lycopene supplements, and you see it exhibited decreased serum PSA levels and increased apoptotic cell death, programmed cell death, and both in the enlarged prostate tissue and in carcinomas. Study number 2 in 2004, men with hormone refractory prostate cancer. That means these really advanced prostate cancer cases where they're not even responding to hormones. The study showed that 50% had PSA levels that remained stable, 50% showed biochemical progression, 30% showed a partial response, and 1 patient exhibited a complete response after treatment. So some patients, even with advanced prostate cancer, respond to lycopene supplementation. Study number 3, prostate cancer patients given lycopene daily for 3 weeks, 30 milligrams a day. They showed smaller tumors and lower PSA levels. Study number 4, they gave them 10 milligrams a day in localized prostate cancer, significant decrease in the PSA velocity. Study number 5, high-grade prostate intraepithelial neoplasm. So these are sort of precancerous lesions given just 4 milligrams a day. These findings suggest lycopene may be effective in preventing the progression of precancerous lesions in the prostate from progressing to prostate cancer, just like the EGCG did in the study that I showed you earlier. And then in this study, where they gave them lycopene or soy extract, or a combination of lycopene and soy, and the study showed a great result. The data suggests that lycopene and soy isoflavonoids have important adjunctive effects in cancer, prostate cancers with PSA relapse disease, and may delay progression of both hormone refractory and hormone sensitive prostate cancer. Both types of cancer were benefited. The really aggressive form, which is hormone sensitive, insensitive cancers, and also hormone sensitive cancers, both showed a good response. That was in 2007. Then you have this ridiculous case report of this guy who's 62 years old, whose PSA level is at 365. I mean, it's out of control. And he decides to just try saw palmetto and lycopene together at a fairly high dose. And after 2 months, his PSA is down to 8.1 from 365. You won't see cases respond like that too often, but that just shows you the power of some of these nutrients, what they can do to induce apoptosis in existing cancer cells, shrinking the tumor mass so less PSA is secreted. This brings us to the discussion of soy extract and soy isoflavones in breast and prostate cancer. A lot of studies show that soy consumption throughout the world is associated with decreased risk of breast cancer, also prostate cancer. It blocks the ability of emerging breast cancer cells from making estrone and beta estradiol. So how does it do that? Soy isoflavones block the aromatase enzyme and the 17-beta hydroxysteroid dehydrogenase. That's how cells and cancer cells make estrogen. If you can block those steps, you're lowering the driving force behind estrogen-positive breast cancers for sure. But these are other ways that soy isoflavones block breast cancer and other cancers, inhibiting angiogenesis, inducing apoptosis, increasing detoxification of estrogen, blocking estrone synthesis in fat cells, and encouraging the apoptosis to mitosis ratio, getting breast cancers to commit suicide at a faster rate than they divide, as I will show you. Also blocking VEGF. We saw that with vitamin E succinate. We saw that with epigallocatechin gallate. We saw that with folic acid. Now we're seeing it with soy isoflavones. So here's experimental evidence outlined beautifully in this review paper in 2004, all the ways that soy and soy isoflavones decrease cancer risk. It's unbelievable. So in 2003, this study, it involved men with existing prostate cancer. They gave them just 100 milligrams a day of soy isoflavones, not even a high dose. It showed a stabilizing outcome on their PSA. By slowing the progression of the disease and therefore potentially delaying the development of symptoms, improving quality of life, and perhaps even prolonging survival. So giving men with prostate cancer soy isoflavones, it's a good idea, but it's also a good idea to prevent it. So here's this breast cancer study with soy isoflavones in 2004. After a core needle biopsy established that these women had breast cancer, they took 17 of them. They gave them 200 milligrams of isoflavones a day for 2 weeks while they're waiting for surgery. There appeared to be statistically non-significant trend towards growth inhibition in the isoflavone group given the 200 milligrams a day of isoflavones is manifested by higher apoptosis to mitosis ratio. I mean, the women that got the soy extract of isoflavones, the breast cells in their tumors in the tumor are committing suicide at a faster rate than the cells are dividing. It's an unbelievable outcome versus, the controls, if you will. So then they said, well, if we look at breast cancer survivors in 2011 at the 102nd American Association of Cancer Research annual meeting in April, they said women who are consuming soy, who are breast cancer survivors, have a reduced risk of cancer recurrence and progression compared to cancer survivors who ingest little or no soy. A lot of women are afraid to consume soy. So this is they combine the data from 4 National Institute funded studies: the Shanghai Breast Cancer Survival Study, the Life After Cancer Epidemiological Study, the Women's Health Eating and Living Study, and the Nurses' Health Study. Together, this included over 18,000 women who had had breast cancer between ages of 20 and 83 years old, who were previously diagnosed with invasive breast cancer. There's a 9-year follow-up period. It showed this. Those who consumed the highest amount of soy, more than 23 milligrams a day of soy isoflavones, were compared to those who consumed the least. Women in the highest intake category had a 9% reduced risk of mortality and a 15% reduced risk of recurrence of their cancer compared to those who had the lowest intake. In previous published articles, I've outlined the multifaceted ways that isoflavones reduce risk of cancer. You can click on that link and see a previous study that I had published on this subject. You can get soy isoflavones from food. I provided you with a food chart to show you the amounts of soy isoflavones in different types of food. But just remember that women that have, PMS and fibrocystic breast disease, uterine fibroids, women going through menopause, that women's hormonal balance is a nice option for them. And I included soy extract at 125 milligrams, standardized grade 20% isoflavones. It's another way to get soy isoflavones from supplementation for a select group of women. And here's a summary of how soy isoflavones reduce risk of cancer. I've laid it all out for you here, and with the references to sort of just rehash your understanding. Experimental studies have shown that soy isoflavones might overstimulate breast cancer cells to divide, but human studies show the opposite. There's a great review in 2010 of the experimental studies and then the human studies using soy isoflavones. What about melatonin with respect to prostate and breast cancer? We know that low levels of melatonin are strongly linked to increased risk of breast and prostate cancer. Melatonin has been shown to improve cancer fighting abilities of the immune system. It also slows down the rate of cell division and encourages cancer cells to differentiate, kind of like vitamin D does. Dr. Lissoni in Italy was the first doctor to use melatonin as a supplement to help control the progression of breast and prostate cancer. So you can read that review here at that link. Remember that melatonin is dropping as you get older, so a lot of cancers occur as you get older. Melatonin also stimulates the CD4 cells to be more intelligent as the quarterback of the whole immune system. So a drop in melatonin is significant in terms of immune cell function. Melatonin gets into cells, it binds to melatonin receptors. It can actually go right to the nucleus and control certain gene expression, and also block other steps along the way that if you look at the review article, really explain in some detail. And in 2015, in the International Journal of Cancer Clinical Research, it really outlined the different anti-cancer properties of melatonin, the influence of melatonin on the immune system and also on cancer. It's an incredible review article. So, after age 40 or 45, I think people should take Sleepy Naturals, and conveniently it's giving you just the right amount of melatonin to bring your levels back to what are levels that can help support immune system function and block some of these steps that we see that are critically important as a chemopreventive agent. This is the dosage recommendation based on your age, and these are other reasons why to take Sleepy Naturals instead of Valium and other benzodiazepines. What about ground flaxseed? Well, there's one incredible study here with 161 prostate cancer individuals who are waiting for prostate cancer surgery. They gave some of them ground flaxseed each day. The results showed that the men given the ground flaxseed had slower replication rates of their prostate cancer cells than men not taking the flaxseed supplementation. The finding states that flaxseed is safe and associated with biological alterations that may be protective against prostate cancer. Absolutely. Ground flaxseed, those mammalian lignin precursors that form enterolactone and enterodiol, just 2 tablespoons a day, get into the prostate gland and block really key steps that stop prostate cells from dividing so quickly, so you prevent genetic mutations from occurring, but can even block the proliferation of existing prostate cancer cells. Very important. One last thing to show you, pomegranate juice. The studies are not that convincing, but there's been a couple of reports in a couple of small trials where they took men that had really advanced prostate cancer. They gave them 8 ounces of pomegranate juice a day. And it seems to be the ellagic acid in pomegranate juice sort of blocks the steps. In some cases, the PSA starts coming down, but some other studies have not shown as impressive an effect, just to warn you on that. But I think men should take at least 4 ounces of pomegranate juice a day, just for preventative reasons. That's just my own feeling on the subject. So this brings you to supplements and cancer prevention. So, I can't prove this, but to me, the biological plausibility is strong that those nutrients that I showed you in the Adiva All-in-One Multiple Vitamin, taking 2 caplets twice a day, give you the meaningful doses of the nutrients that we saw in the early part of this discussion, just to make sure that over your entire life, you're getting key nutrients that have shown sort of biological chemopreventative effects. And I also take Adiva Nature's essential oils. It has, flaxseed, borage seed, and fish oil, because those essential fatty acids get converted to prostaglandins that slow down the rate of cell division. That's very important in preventing cancer, as has been shown by many studies. And then in Nature's Relief, where you have the curcumin and the boswellia, as well as, white willow bark extract and ginger, all these anti-inflammatories, but curcumin and boswellia in human clinical studies now have shown evidence that they can have important anti-cancer properties. Same with Adiva Body Burn. I take two to 3 capsules a day because I want to get the EGCG to have these important anti-cancer properties that it's been able to show at these high doses. But also, the other components in Body Burn are helpful in increasing thermogenesis, shutting down appetite, improving glucose regulation. I think, in our society, these are important physiological properties to be able to access. After age 40, I like Sleepy Naturals to get the melatonin and the other synergistic things that induce good night's sleep. But melatonin for immune modulation, and because it has anti-cancer properties. After age 50, I think men should take Prostate 40 Plus. It has not only lycopene and soy isoflavones and saw palmetto, which have been used in human clinical studies with men with prostate cancer, but it has other nutrients that help to prevent prostate enlargement and reversing prostate enlargement. Then at age 50, Adiva Immunodetox Prime with the indole 3 carbinol and the reishi mushroom extract, which have been shown in human clinical studies to be impressive. But the experimental evidence is just overwhelming on these things, as well as the benefit of the milk thistle and the astragalus that's in that product as well for immune modulation. Other considerations, if your vitamin D level is not at least at 75 nanomoles per liter, you might need more vitamin D than what's in the multivitamin. Ground flaxseed, 2 tablespoons a day. I think even to prevent breast cancer, this is important because it's been helpful in fibrocystic breast disease. And I would say 4 ounces of pomegranate juice a day would be a good idea. I usually mix like a mushroom blend into that pomegranate juice and drink it down, just to get some additional medicinal mushrooms, especially during the pandemic. I think it's very important. So I want to thank you very much for attending today.